provide access to specialty care, primary care, medications, people that don't want to go see a doctor or don't feel comfortable going to an emergency room, just bringing them that care straight to them and into their encampments, into their homes, and just, yeah, being that bridge to care. So we are really excited to partner with you all and come out this way. I personally have been able to go out with Marissa, and I met with Curtis, and so I'm really excited about this and just bringing the care this way too.
Great, thank you, Ms. Lucy, appreciate that. Had a great presentation from your team, maybe last week.
Yeah.
And very impressive menu of services, and the fact that you're really bringing that primary care to the individuals in the field. Mr. Menendez.
Hi, I'll try to keep this brief. As you know, State Senator Otrobo's thing was canceled today. We planned to do an open house to include some of her staff and the community members at the Oasis Inn and Suites and the Social Yards. Mr. Vino at that property has been working with a few of the organizations here to provide rooms and so forth, and we have a lot of great programs coming. We are still going to do our open house from 3 to 6 for any community organizations that want to come by, business owners and so forth. There are some flyers over there if you want. I didn't put the location. Everyone knows it's by Stater Brothers in 29 Palms, but I've been running around like crazy. Secondly, starting next month, we're going to be putting on an event called Founders and Freedom. Sorry, I made limited copies of these, but basically it's highlighting our 2 new great public spaces, Founders Plaza in Yucca Valley, which just opened, Freedom Plaza over here. We'll probably do the first one in Freedom since that's now officially open, since we're still working on the public process there. But we're trying to make this an informal town hall type place for people to come together and just chat, very informal, have coffee, talk about issues. And lastly, starting probably with the next meeting, hopefully, I do have a new, we're working on a great joint a public area navigator / community health worker role. I've been working with some national advocacy companies on that, and I will have more news on it then. I'm gonna have a new government affairs person that's gonna be taking over. Right now, this person cannot start because they're still furloughed from the government. So until their ethics things clears it, at that point we can make the determination. We do have a RFP out as well it's a 20-hour contract position in case we can't move forward due to whatever that is. But I'm excited because I've been working with a lot of national advocacy people who are looking to come help us in this area. So it's JTGCA. Feel free to reach out to me if you want more info, and thank you all for coming. We had a good turnout today.
Thank you. Ms. DeFalco.
Yes, hi. Active Kindness has been giving out meals every day now in 29 Palms instead of 3 times a week. We've ran across a couple of issues. I know that we have services if you have mental challenges. We have services for drug addictions. The services that we need are for families with children that don't fit in either one of those categories, because the organizations for those categories can only utilize their funding for those categories. The second thing is that for the past month, we have been missing an elderly unhoused man. I did post it on Facebook to try to get his name and his picture around. He has the onsets of dementia and Alzheimer's. He's also a meth addict. And so between myself, Megan Cosgrove with the Adult Protective Services, we reached out to the jails, the hospitals, the coroner's office, literally everywhere we could think of, including his bank account, that has not been utilized since the first week of July. So if you'd like me to email you guys a picture of him that you could pass on in your areas, that would be great, because I feel right now he is in a very bad situation.
Mr. Falco, if it helps, I'll be talking to Captain Warwick this afternoon, and so if you'd like, you can email me that photo. I'll send it out to him, and then I also can pass it on to my code enforcement team and any other folks who are maybe in the field.
And if I could step in, I've been working with Megan on this particular case for almost 2 months, and I spoke with the gentleman's brother yesterday, and I tracked him down in Pomona, and he has not had any contact from his brother in several years. So yeah, this individual has been missing since the beginning of July.
And also to piggyback on, he was actually housed at my location last. And so I am the one that reached out to Miss Megan in order to start the looking for. I think that they have reached out to Dr. Stone, code enforcement for Yucca Valley, as well as 29 Palms. And I just want to commend you because I know you have gone into all of the encampments, because when I've gone behind you, they said that, oh, Miss June has already came out here and look. So I want to take my hat off to you because you don't have to and you've done it. Thank you.
Could you repeat his name?
I can't
His
give
name
his
is
name.
Gary Church. And he's been a client of Reach Out at the Senior Center for 15 years since I've been there.
So what, like male Caucasian?
Male Caucasian, he's about 5'6", 5'7". You've probably seen him around town. He kind of walks with a hunchback a little bit.
What does he weigh?
Very, maybe 140 pounds.
Hair color?
Yeah, blondish, but he's also bald.
What, how old?
He is, I believe, 65, 66.
73.
He's 74.
Okay, I couldn't remember, yeah. I have a copy of his ID in my file, so if you need a copy of that, you have to give it to me.
Very good.
Can Janet or Robin, can you send that to me?
Yes, I can. Yeah, I'll get that to you.
Appreciate that.
Thank you, sir.
If you guys follow Jen's Facebook, it's on her Facebook.
Oh, really? Okay, very good. Thank you. All right, very good. Mr. Falco, anything else?
No, that was all, thank you.
Okay, very good. So those are all of the public comments.
Stone,
Yes,
can I
ma'am.
make just a really quick announcement?
You betcha.
That the Morongo Basin Healthcare District is planning their next health fair at Freedom Plaza on October 11th. The vendor email has gone out. If you did not receive an email, please see me after, and I'll make sure you get a vendor application if you would like to participate in our annual fall health fair at Freedom Plaza.
And that was October?
October 11th, Saturday, from 9 to 1.
Great, thank you very much. Okay, very good. So let's move on to the reports and updates. So this is an opportunity for the regional board member representatives to provide a 3-minute update. And so, Mr. Yakima.
Thank you. Just a couple updates. One, we did have the opportunity to meet with our partners here at Wellness Equity Alliance, right? So thank you for coming out and sharing what you do. Secondly, the town's pretty excited about a potential bill with Habitat for Humanity that we're contemplating in the town that might be able to provide some additional housing opportunities for individuals. So continue to work through that. Lastly, we have lost one of our food distribution programs. I think it's the one on the 4th Thursday of the month. We still have a number of others, and we'll update our information and calendar to make sure that the public knows when those other ones are occurring. The one that was lost, I believe, had some federal funding tied to it, so. But we still have opportunities for individuals, and that does not include, obviously, the nonprofits, houses of worship that continue to help our families in need. That's it, Dr. James. Thank you.
Thanks, sir. Appreciate that. Mr. Harris.
Oh, good morning, everyone. Just real quickly, as of right now until June of 26, Basin Transit is offering the Students Ride Free program. And it is free rides for all kindergarten through grade 12 students. They just have to show a school or government ID. And if you want, if you go to basin-transit.com, you can see all the routes. So, and that's all I got. Thank you for all being here.
Very good, thank you so much. All right, so it looks like I'm next, and if Councilwoman Ramirez, is she here yet? All right, so in terms of 29 Palms, been working on some, I think some good things. So still working or trying to create some sort of partnership with the Coachella Valley Housing Coalition. That is an organization, Coachella Valley based, like Wellness Equity Alliance. They've been in business, gotta be over 40 years, and they do something unique, and that is it's a self-build concept. And so what they do is they get some lots in a community, Coachella or Imperial, and they will essentially find families that qualify, so you have to work, you have a certain income, you have to be within certain parameters, you have to be able to donate 1,500 hours towards the construction of your home. And that could be through you, through family members. And so typically it's about maybe 14 months to build. So still trying to see if we can get them up to 29 Palms. They've never built in San Bernardino County. It'd be wonderful if they could expand. They are being pushed out's not the right word, pushed out of the Coachella Valley due to the population increase. Because once a city's population exceeds 35,000, they no longer qualify for that program that they use, the USDA program. So working on that, also working with a great organization called NPHS. That is an organization that builds and then also rehabs homes. And so that was something that I found interesting. Really, are there things that can be done to keep people in their home for longer, right? Can they rip out a bathtub and install a shower that they could roll a wheelchair in or place a walker outside? And so Councilwoman Ramirez has actually been doing a lot of work with NPHS, a very impressive organization, and curiously enough, one of California's largest affordable housing builders. Food distribution, that continues to be a priority within our city. Of course, we've got the 29 Palms Food Pantry. They do great work, but that also Feed the Need. And Dr. Perry Ford is here, and that is something that is overseen by him and his team. They also serve, I want to say, nearly 1,000 people a month, maybe 500 to 800 people a month. And so that's something else that is important. Something that the City Council recently had approved due to the overwhelming support from the community, and that was a project called Of Land. That was a nature conservation focused development that was going to occur by Indian Cove. That was going to be important, at least relative to this group, because that project conservatively would bring $500,000 to $800,000 a year of direct revenue to the city, and that is revenue that we could fundamentally use to the city budget for Feed the Need, or for affordable housing, or for different school programs. Unfortunately, there were some folks who filed a lawsuit, and that became public yesterday. And so that project is, that's an unfortunate attempt to try to thwart the public process. But aside from that, that's all that I have. Councilwoman Ramirez, would you have anything you'd like to share?
That was an amazing update. I will add, I had the honor and privilege to meet yesterday with Mrs. Smith. She is the wife for the Commandant of the United States Marine Corps. Some of you guys know this, my husband is a Marine, so it's very important to me. Some of the spouses, active duty military spouses, brought up that, food insecurity is still a big issue for the lower ranking Marines, the younger Marines. And I actually used my platform to talk about the amazing work that the Sanctuary Church and Feed the Need is doing. And they are very interested in finding a way to partner stronger through the Navy Relief Society. I'm pretty sure I'm missing a letter in that acronym, but the Navy Marine Corps Relief Society, there we go. So, just thank you for that. Again, we're working with NPHS. I love their Aging in Place. And then I also met with Congressman Obernolte, and we're working on mainstreaming some more services that are specifically to veterans through the VA. And I do have a link that was given to me if your organization would like to become part of the VA community care system, meaning that you would be able to contract and work with them. I'm not busy enough, so I've taken on that role that I would bring in the community and get as many people added to the vendor list as possible so that we have local resources and the veterans don't have to travel to and from Loma Linda. So that's it for me.
If they do reach out, they drive them.
Thank you very much.
And if they do reach out, we'll drive them.
Can I ask you a question, Dr. Jones?
Sir?
Councilmember, forgive me for being unaware, but you had mentioned that some of the Marines, particularly the lower ranking ones, are struggling with food insecurity. Can you explain that a little bit? Because that doesn't make any sense to me.
So I think there's a cost of living, and I'm saying this as an active duty military spouse. My husband's been in for 12 years. Cost of living doesn't always match what you get. So your base BAH, base allowance housing, is qualified off of your rank and where you live. For example, when my husband was in the drill field in San Diego, we used to get $3,200 for housing. Now, same rank, but 29 Palms, we get 29, and that's with him picking up an additional rank. And so if you're looking at, if we chose to live off base, which we do, because when you live on base, they take all your BAH. And even if it's a 1-bedroom, small apartment with the roof leaking, which I also put that out there for whoever lives in base housing, that we need to fix those things, but they'll still take the full $2,800. So we decided to live off base, and I'm just using our family as an example, but if there's a Marine Corps family with maybe mom that's stay at home because they can't afford childcare, and they've got 3 kids, and their rent, their BAH is $2,800, but their rent and bills is $2,600, that leaves you with $200 for food for the whole month for a family of 6. It's not gonna go very far. And so those are the types of things that we're trying to find. I mean, this is gonna be a higher level federal government, DOD, trickle down effect eventually, but as long as I'm here, I'm gonna use my voice and my platform to make it right.
Ms. Fernandez?
Councilor, I have a question to follow up on that. Do we have data like on how many Marines have second jobs and so forth? Because my former company probably employed 24 Marines and Marines' wife, and I can recognize this as it's not isolated to families, it's single Marines too. Like, they are struggling to. It would be interesting to know if there's any actual government data on how many of them work 2 jobs to like make
that
meet.
Was brought up, and I think it's the Navy Marine Corps Relief Society is working on that. Yeah.
It was brought to my attention that service members and their families cannot utilize benefits of WIC like everybody else. Is there a separate program for you?
It depends. You can still get WIC, you can't get SNAP, I believe is what it is.
Oh, but you can get solo.
But that's again assuming that you qualify.
Yes, but okay, so you're not just disqualified due to being a service member.
No.
Want to double check that was legit.
And I'll add, it's not a new problem. So Lance Corporal living in San Diego, California, a new baby with a kid, we absolutely used WIC, went to the food pantries, we struggled to make it through.
Yeah.
We were in a place where the rent basically jumped up to match BAAs after 6 months. So you do a 6-month lease, it's cheaper, and then they put the rate for rent at exactly what your BAH is, so then you're left with no extra money to pay for food.
So my daughter is 54 years old this year, and my husband and I lived on $75 a month when she was a baby. Well, before she was born in 29, and yeah, if we wanted to go and do anything, we ate, anyways, box food for a month, and like we wanted to go visit my mother in Texas, we had a Volkswagen, $20 was what we figured we'd need for gas, so we lived on hamburger helper for a whole month, or beans for a whole month, so that we could go and do the things that we wanted. Yeah, it's not easy. And with the cost of things today, I can't imagine.
Thank you for sharing that, Susie.
I was just trying to piggyback off of what you said. It's true. I worked in military housing for 8 years. BAH equals rent, rent equals BAH. And the service members do struggle. But in that BAH, they don't pay light, they don't pay gas, they don't pay water unless they're out in town. And out in town, the housing is unaffordable because they do raise the rent to that max because they know that they can get that money. If the service member doesn't pay, they contact the commands, and then it's a whole trickle effect. So it is. And if you have a leak, you need to make sure you let them know you have a leak, because if you don't, they will charge you for that leak.
Well, very good. That's great knowledge. Thank you very much for that. Councilwoman Ramirez, anything else?
That's it.
Okay. Ms. Lakita from Holding Hearts.
Hello everyone, thank you so much for being here today. So Holding Hearts has great news. We have found that currently we have a bed capacity for this region of 56 beds, and we are opening up 2 independent living for seniors. Thank you, Robin. Robin's referred a couple people over to us. We are opening 1 in Joshua Tree that will house 8 seniors, as well as we have 1 in Paradise, which is right across from Walmart. That is a smaller venue that is gonna house 4. My 4 is already filled. I have a total of seniors. Seniors only. And it's for the independent living. With our housing, we offer food, shelter, all amenities paid, and it's $8.50 a month. That brings us to, I believe it's gonna be 61 beds that we'll have in this region. So some of our programs some of our housing is gonna be program focused, because some of my seniors like to smoke weed. And I can't have that with my individuals that I'm trying to keep clean. So Grandma and Grandpa has to go and do it in the senior home. Hey, I'm federal funded and I cannot have it in my regular contract, so.
Those are the teenagers of the 60s.
All right, right.
What's the age for seniors considered?
55 and over, okay? The other problem, my whole thing is I am a problem solution type organization. Don't like to complain, I like to put boots on the ground. What I've noticed is when we take our clients to the doctor, can I have your blood pressure? How much do you weigh? Anything wrong? No? Okay, have a good day. Wasn't enough for me. I found a contract for genetic testing. What this is gonna do, basically my clients will be swabbed, it is sent out and their results come back. What that does, it's gonna catch problems early. They're gonna stay ahead of the symptoms. It will give them peace of mind, rule out any health issues, save money, early care, avoids costly treatments, protects your family from knowing your status. It's fast, it's private, and it's judgment free. It's free of charge. You can pass it out. It's free of charge. The one thing that you do have to have is your ID, and they do need to know that you have health insurance. So we take those two things. For me, you guys know I'm 10 toes down, boots on the ground. So we have an office here in Yucca Valley, but that's appointment only. I also have a senior center, I don't know if you guys know, in Adelanto. It is a walk-in at that location. If you have 10 or more individuals in your facility, we will do a site-on treatment plan with you guys and come to you and do it. I just really want it, you know what this does? It equals out the playing field. Because if you have money, you get good health insurance. You're there for about an hour. I'm sitting here like, really? But if you don't have it, you're in and out. This makes it so that our unhoused individuals that are low income, it just evens out the playing field so that they know what's going on with their body. Thank you.
Can I just ask a quick follow-up question? Are you saying that they're mandated to do that to stay in your houses?
Not at all. I never said that, ma'am.
No, that's not what the question.
No, not at all. What I'm saying is that this is for anyone in the whole county of San Bernardino.
So
But if you're in my
They
housing, my seniors, some of my seniors have aches and pains, and when they go to the doctor, they don't find what's going on. I'm just trying to find a solution so that they will be able to know about their well-being. Never force, I don't get down
So
like
it's an
that.
offering that
Yes,
they can
ma'am.
take advantage of?
Yes, ma'am. Yes, ma'am.
I just wanted to let you know that I think it's wonderful what you're doing, but it would be great to partner because sometimes results can be scary.
Yes.
And so being like providers that can go to where they're at, we'd be happy to like meet with patients or talk to them and go over results when they're scared of them. Or we also offer testing, like HIV, syphilis, Hep C, all testings and stuff. So if you ever need like patients to be seen and they don't want to go into a provider, we're happy to partner.
And I believe I received your email and I responded to you. I was just waiting to hear back from you.
Might have been one of them.
One of y'all. All of y'all. Yes. But yeah, I'll give you one of, if you take one of the flyers, you can call me and then we can make an appointment from there. Any other questions? No? 1, 2, 3. Okay, I'm done.
Very good, Ms. Nikita, thank you. All right, so let's move on to the Morongo Basin Conservation Association. Ms. Janet.
I worked on this for 3 hours to get it down to 3 minutes, you guys. We had a robust working group meeting on July 25th. A lot of discussion and connections are being made toward various projects. One project suggestion, and this is a shout out to Alex, would be maybe better at the county scale, and that would be a mental health focused workshop with the Department of Behavioral Health, street outreach and street medicine teams, cities, providers, and most importantly, law enforcement, so we can all get on the same, better page. So we're aiming for the working group meetings to be the last Friday of the month, but as the shower program is this that day, the next working group meeting is on Friday, September 5th, 9:30 to 11 at the Joshua Tree Community Center, which is down there. And OHS, Office of Homeless Services, very kindly dropped off some outreach supplies, and we distributed them to Reach Out Yucca, Pacific Clinics, and Robin at Reach Out Morongo. Thanks to Joy for organizing this. This was a trial run, and so hopefully there will be more, and we can distribute to more agencies who do outreach. There is a reporting form that I will be getting back to you shortly. And I went to 3 2-hour-long HAP 6 planning meetings last month in San Bernardino that OHS asked me to attend, and Claudia did an excellent job running those. These were required by the HUD state for the county's HAP 6 application to the state. So it's like the front runner thing that happens before we see the HAP 6. And during that process, I saw that the HAP 5 allocation from the state to the counties and the COCs were based on the 2023 point-in-time count numbers. I wrote Marcus, poor Marcus, to ask that our COC's allocation to the region, as in what comes to us, were also based on these 2023 numbers, as opposed to the 2025 numbers, as is suggested now. And I am working on a proposal for a more equitable distribution of the HAP funds to the regions. The Central Valley has the largest count by far, point-in-time count by far, but they are a high resource area and receive millions in other grant funds from the county that we just do not see. And considering our large unincorporated area, the county also has the municipal responsibility for our area. So we're gonna double dip soon. And the Board of Supervisors, this is kind of serious, but there's a point to what I'm saying here. So the Board of Supervisors introduced an anti-camping ordinance on the consent calendar at Tuesday's meeting. It just happened. There was 15 or so excellent public comments over about an hour against this and the criminalization of the unhoused. The ordinance is on the consent calendar for September 9th, so there's still time to comment. That's when they would actually pass the ordinance. I only found out about this the afternoon before. I wrote Supervisor Baca, who was the co-chair of the COC, to please pull the proposal and run it by the COC for feedback. That's why we have the COC. Out of respect for the COC and all the work we're putting into this, and out of practicalities, as this will impact agencies, especially here with so much unincorporated county land. The supervisors passed the introduction without comment, but there's still a chance to comment because the actual passing of the ordinance is on the 9th. Another concern is Senate Bill 634. That prevents cities and counties from passing ordinances that could criminalize providers for helping the unhoused. That sounds like a good idea. We should protect our providers. Well, our county wrote a letter in opposition to this protection. So I've requested a copy of this letter from State Senator Sasha Perez's office.
Your 3 minutes are up.
Okay.
Just to clarify something.
I was so close. One more sentence.
This is a slippery slope.
Yeah.
So last year, the City of Grants passed versus Johnson, 603 US 502, which was passed in 2024, is a United States Supreme Court case. So it's federal law that local government ordinances within civil and civil and criminal penalties for camping on public land do not constitute cruel and unusual punishment for homeless people or unhoused individuals. So I think you just have to be careful when you're looking at federal law to involve us and say, the COC is going to do this, because I took an oath when I took office, and I have to participate in lawful activities, behaviors,
well,
things
this is
like
what
that.
has to be explained. This is what
stepping
has to
out
be
of that
explained.
conversation for the record.
Well, this is what has to be explained, is exactly what's going on. There's the federal laws, there's the county laws, there's the state laws. The fact is that this is a state law that they're passing to protect the providers who are out there with the unhoused. And what it started was in Fremont, they passed a law to criminalize the providers handing out blankets, but there was such pushback, they repealed that. So this is a state law to kind of prevent that sort of thing happening again. So all I'm saying is we need to have these discussions about policy at the COC so we all understand what's going on.
Good. Thank you so much, Ms. Johnson. I appreciate the time and the research. All right, so let's move on to Reach Out Morongo Basin. Ms. Robin.
Hello. I was gonna have a very brief thing. We're just busy, and I'm going to defer because we have lots of other things to cover today. Thank you all.
Thank you so much. I appreciate that. And Mr. Daniel from Rescue Residents.
Hey, I will also keep it pretty brief. So we're still working to develop the property out in 29 Palms to be able to build our ambulances. But at the time we currently have, the property does have some rooms. So we actually have our 4th client starting tomorrow to be housed there while they develop a plan to kind of make themselves successful rather than ending up living out of their truck while they conduct their transition. Our Marine Corps literally finishes active duty on Friday and doesn't have anywhere to go. So no plan. So the transition office on base, I've started coordinating with them because she sees this pretty regularly where they are transitioning and have zero plan to go do anything to help them kind of find a place to go. So still need a piece of heavy equipment to be able to move dirt around and a heavy duty trailer that can tow ambulances if anybody wants to help facilitate that. Those are kind of our 2 key needs right now.
I appreciate you saying that. I will talk to some folks who work at the city in their capacity as private individuals with using private equipment.
Sure, thank you.
Okay, thank you so much for that. All right, very good. So now we can move on to the Office of Homeless Services. Ms. Doyle.
So good morning, everyone. Announcements from our office. The shelter provider session for the month of August has been canceled, and so has the multidisciplinary approaches to end homelessness. Both of these sessions are going to become quarterly, and for the shelter provider sessions, we are planning an in-person session. It's going to be down in San Bernardino, and it's going to be in person. The topic for that day is going to be flu, public health, and we partner with public health for these. They're going to try to bring out their mobile medical unit that day, and possibly, it's not guaranteed yet, possibly provide flu shots. The next Continuum of Care Board meeting is going to be August 27th, and it's going to be at the Dorothy Ingram Learning Center on 670 East Carnegie Drive. An announcement has been sent out for that, so if you receive our Office of Homeless Services, if you're on our mailing list, you should have already received that announcement. Our next HMIS Town Hall meeting will be on September 3rd, and I believe that that's going to be virtual. We did have a bylaws committee meeting Wednesday, August 13th, and we are planning another one on October 8th, and there'll be more information on that one to come as well. All of these meetings, all of these announcements you should be receiving from the Office of Homeless Services mailing list. If you're not on there, send me an email, and I will make sure that Joy and I will make sure that you're on there. Trainings coming up. So we've been conducting the COC HUD trainings this whole month. We've had 3 already. We've had about 40 to 60 people in each of those trainings. They're virtual. We have one more coming up. Dr. Leslie is going to be giving that, and that's going to be on August 26th at 3 p.m. with assessing equity. Then the focus strategies, housing-centered practice, supporting clients from first contact to stability. There is a training scheduled up here in the East Desert, September 10th. And I believe that if you've registered already, the flyer, I brought a couple for you guys to go ahead and see. This has also been sent out. A reminder of this will be sent out again. There's a QR code on here if you want to pass them one that way and one the other way.
And Ms. Doyle, the name of that training again?
It is the housing-centered practice, supporting clients from first contact to stability. So the one up here, if you haven't already registered, I do not believe that one is closed yet or full. So the QR code is there. Please make sure that you register for that. We want to make sure that we have representation of the Morongo Basin, just to show that, hey, we need trainings like this up here as well. So we keep trying to bring them up here, but we need everyone to register. There is a federal grants management training. Actually, it's financial management best practices training. This was sent out yesterday through the OHS website emailing list again. So please look at that. There's a QR code to sign up. This one, however, is not for those folks who are boots on the ground. This one is for those who are the people who work with financial management of the grants within their agency. So because this is going to be very popular, we're limiting it to 2 people per agency. And the reason for that is because we'd like to get as many agencies as possible on these. And then there's going to be more training coming up. There will be a virtual component later on throughout beginning of next year. But this is the beginning. This one is in person, and it is going to be down the hill in San Bernardino as well. So I'll pass these so you guys can see it. These were sent out, so you should be able to go ahead and find that email and register your agency. Please keep in mind that it's for those people who are working with the grants, working in the finance portion of your agency. Finally, as Janet mentioned earlier, we did have this HAP 6 stakeholder engagement meetings. Our application, I believe, has been submitted already, or it will be submitted this week, right?
Yes.
Yeah, so it will be submitted, but they did a great job. The people who showed up to these meetings did a great job, and we got some really good information, and we're hoping to continue those type of meetings as we move forward in other grants. So that's all I have for today.
Very good.
Thank you.
Quite a bit. Thank you for that update. And thanks for making the drive all the way up there. It's not a quick drive. So next up, we can move on to the consent calendar, but before we ask for a motion to approve the meeting minutes from July 17th, I believe Mr. Harris would like to amend the minutes.
Yes, hi everyone. Couple of minor things. First of all, there's a misspelling of Steve Bardwell. It says Brad. So for the record, we'd like to see that changed. And then I want to comment on the report offered in the minutes by Janet Johnston. There is a statement that was appropriately noted that she said the county had to show a lower count, point in time count, to avoid losing state funding. That is a serious allegation that is not necessarily based in fact.
That's not exactly what I said either. I said there's issues about that.
And for the record, I take objection to that, and I would like to say that that is not the view of the entire steering committee. It is a personal, it was a personal allegation. So
I wouldn't say it was an allegation. It's something that has been discussed, and again, we need to understand how that works with the funding.
Sure.
So it didn't appear with a HAP 6, because that looks like it's a 1-to-1, but that might be the case.
He's just amending it.
I'm just saying, right, exactly,
So,
and I'm just clarifying that, that's not maybe exactly what I said.
No problem.
It's all how it gets written down.
Do we have a motion to approve the minutes as amended by Mr. Harris? Do we have a second?
Second.
Okay, so Daniel is the second, and Mr. Harris was the first. All in favor?
Aye.
Any opposed?
No, that's fine, I just don't exactly, I didn't agree with what he said, but I agree with the fact that that's not exactly written right in the minutes, so that's fair to take it out or what have you.
So would you like to?
I said there's issues with that, and this has been explained to us at point in time count trainings about how the grants work. And they are saying that there is an issue with keeping the numbers lower because there's like a grading system in how they do the grants. And if you're not showing improvement, they can ding you with the funding. But I'm not clear if that's the HAP funding or if that's other funding. So that's something we need to understand in all the processes. And that came from Urban Initiatives, when we had that discussion with Joe Coletti. So it's not a clear thing, as I'm saying, but
okay.
That's all. So I'm fine with it getting taken out. That's not an issue.
Thank you, Ms. Janet. I appreciate the feedback. And so now we can move on to presentations. And so we've got the Office of Homeless Services presentation for Mr. Dillard.
Activities in this region, because it just makes sense now, looking at the participation, looking at the individuals who are doing this work, to make sure we pull something up this area to get the same interaction and involvement. And then there's not this expectation of why didn't these individuals show up? Well, I can tell you why now. I'm pleased to be here, and I do have this presentation, but I haven't met everyone here. So my name is Marcus Dillard. I'm the Chief of Homeless Services for San Bernardino County. I actually came here from Riverside County, working on the homeless service side there, working on Project Room Key, working in the River Bottom, overseeing Section 8 programs, HUD Dash, HOPWA, Mainstream 811, Emergency Housing Voucher Program, and then we also did all the HAP and encampment response in Riverside County. But I often tell people, because to get into homeless services, you gotta have a certain heart for homeless services. And my path was a little bit different. I was an accountant for 15 years, doing really well. I was in the Marine Corps for 8 years, firefighter Marine Corps. And we went through a housing crisis back in 2008. And my family, we ended up getting displaced. We were homeless. I didn't know who to go to. My wife found US Vets, and they ended up helping us out with assistance. But during that time, someone saw me and said, hey, would you like to do outreach? And I was like, yeah, outreach, but I thought church outreach, you know, like going and tell people about Jesus, right? And then I ended up going into the Santa Ana River Bottom, but I could tell you I had a passion and a love for the work at that time, because as I was going through being homeless myself, I considered taking my life, because military, we have insurance. And I thought my wife would be sick if I, you know, because I felt like a failure. And that opportunity to get involved with homeless services, I'm up till midnight, 1 a.m., answering calls, getting people connected to resources. So I'm a boots on the ground person. I started in outreach services. I went through veteran services, opened up that new building at March Air Force Base that US Vets has, moved all the people from the old barracks that everybody remembers. And so I've been doing this work for an extended period of time. And then when I came to San Bernardino County, the Office of Homeless Services predominantly was an administrative entity. They served the COC only. And I thought when I came here that we needed to kind of shift that dynamic a little bit, because in order for the Office of Homeless Services to serve as the hub for homeless services for the county, it was important that we began to understand how to operate things programmatically, and then put a different energy in the county as a whole around homeless services. And I've been here going on 2 years now. It'll be real soon. I'll be on 2 years, but I can tell you, we went through a metamorphosis in the Office of Homeless Services and what we do. My staff went from 8 to 42. It's because we took on community supports. I'm right now taking on navigation for children and family services to help those that are justice involved that are being released from custody. I do the outreach for all of the county response, and some of the things that Janet brought up. In another time we could kind of talk about it, and I can give you a little bit more of understanding on those items. But I say all of that because we're invested in this process. We're invested in getting the real services to people. And even though you see things get passed like ordinances, those are required because of what happened federally. And then our governor came out and said he wants these encampments cleared. And so what's gonna end up happening is, for those that maybe don't see the tea leaves shaping up, is they won't release additional state funding unless you have an ordinance and an encampment response in place. So there's gonna be these things that are required. So you see the requirements change on HAP, because I heard about how when HAP first started, everyone was applying, they were just getting it. And then when I came, I started putting things in place and everybody got upset with me. But it was because the governor is asking for more administrative accountability in the funding that we have. And that's gonna require us being responsive to the individuals in the encampment. And so it's not just about an ordinance, it is about an encampment response strategy, which is what the county had to adopt in order to resource the individuals with support before any clearings are actually conducted. So there's a lot of activity and a lot of things that are going on around homeless services. And I could go into this about the point in time count, but let's talk about what we're doing that can help you guys right now. So Office of Homeless Services, when I came here, the HMIS system was very complex for some. I hated it as outreach too, I did, because I always wanted to just serve the people. But what we understand on the administrative side is the state pulls that information from HMIS and uses that to understand what's going on in your particular region around homelessness. So then we need to do a better job of getting the individuals resourced with the things needed to help with HMIS. So right now I'm working with an agency to connect what's being done under CalAIM with what's being done in HMIS, so that you only have to do one reporting system instead of it having to be done through two pathways. We'll serve as the administrator for that, but open those licenses up for all of the community supports providers that doing the housing trio for the IEHP. We already give information and data to IEHP. We just need to see how to make those two pathways communicate. The other thing is, I just heard this young lady here, and I apologize, I don't have everybody's name down, but about the food pantries and giving out food. So we bought scanners, we bought those systems, and we bought card printers, because there's a system for the customer pathway where you can give actual cards to people who are in your shelters, who are in HMIS, and just scan those cards, and it'll give them credit for the service, like giving them food, giving them navigation services, so it expedites the process instead of going through a period of time. Now we didn't just give cheap scanners. I think I paid $2,000 for each one of those printers, because I wanted to give people something good that they could use. We're taking the cost on that. I heard about what you were doing and what this gentleman is doing, and we can make sure you guys get them as well. If you're looking to get your individuals actively into the HMIS system, it'll help out, and we'll cover the cost on it. The other thing is we're working on the kiosk right now. We're finalizing getting those kiosks out. We've worked with the county agencies, because what happens to a lot of people who are homeless is they're not able to recertify their information, so what ends up happening is they lose their benefits. So we worked with TAD, we worked with DOS and some of the other agencies to make sure there's a scanner system to this kiosk, to make sure there's pathways that they can update their information so that there is not a disturbance in services that they're dealing with the county agencies. So I have literally 10 kiosks in my office, so you can't even walk in there right now. And we're testing one of them because we want to make sure everything is the way it needs to be before we put it out on the streets for everyone that's actively working. The scanners that I mentioned to you, Salvation Army is already using in the city of Victorville because they have larger shelters, and we use them as tests for us before we get them out to everyone else. We have a landlord incentive program that we created that gives landlords $1,000 for giving us units. In that also, we have some money to help individuals with homeless prevention, because ESG has homeless prevention, but you have to be 30% AMI to get that. This other one allows those individuals who may have a little more income to access those services, so my team is able to help support with that as well. I brought up earlier the community supports team that's doing outreach. We just hired an outreach coordinator. I sent an email out yesterday announcing it. We'll have those individuals coming out this way as well. But in addition to that, we're trying to get in a hotel that we can serve as a non-congregate shelter in this area, so that individuals that are found when you're out doing outreach can actually go into this shelter, and then our team will activate with navigation. We have an internal process where our team refers to our housing navigators and gets them into the process of getting into housing. We actually just started an innovative map where we're doing, where we're making housing placements so that we can track the rents in the areas and see over the years how rents are changing and monitor those things. So my HMIS team just set that up, and what we're trying to do is be able to say, if you're looking for housing in a particular area, you can just go into our map, see what the rents are in that area, see if the landlords take people with evictions, if they take people with pets, and simplify the process. And then we have a pet policy that we worked on, because we understand pets are a big issue for individuals that are coming out of homeless encampments. So we're looking to partner with some agencies that are able to foster out the pets or adopt out the pets while they're looking for housing, but they can go visit them, and it's a safe environment so that the individuals feel comfortable with what's having to be done while we're working with them on housing. We have our HSTAP program, which has bus passes for everyone now. So we have bus passes that we just purchase for individuals to access. You just have to make a request, because if we give out a bus pass, it has to be to an individual. That's the thing about public funds. You have to make sure you track who the bus passes go to. And then, I'll get back to you. And then the other thing we have is in addition to the bus passes, we also have gift cards that we just purchased, because there's a lot of individuals I meet when I go to encampments that are willing to clean up the areas that they're in. What I want to do is incentivize that a little bit by giving them some gift cards and saying, hey, let's work to keep the areas clean, and while we're working with them to get them stabilized and get them in the housing, because I don't have the shelter to take everyone. I think I have like 60, 70 people in the shelter right now. But we're working to see how we can increase capacity and be able to help individuals get into housing. There's a number of things going on with funding and things like that. So what we've tried to create is technical support sessions that we meet with the providers. We go over their HMIS, we go over their programmatic scope, we go over their budgets so that we can add more assistance. I hear all the time this narrative about bad providers and what they're not doing. I took the motive of saying, as a county, are we doing everything we need to do to help these individuals perform the way they should on grants? Because there's a lot of people with good hearts, but we gotta make sure that they're doing the right thing by the funding. And I think that falls on the county as well. So we're doing what we need to do to try to make sure that those things are happening the way they should. So to do that, Office of Homeless Services has shifted the way that the org chart is. I actually have a fiscal team, I have a programs team, I have an outreach team, I have a HMIS team, and I have an administration team because there's so much red tape with the county. I just need somebody to deal with that. And I say that jokingly, but it's true. So we have to make sure we're following the rules and procedures of what we have to do at the county to make sure we comply, to make sure that we're doing right by them. So I have to have staff that make sure we're doing the right things as well. We have an internal monitoring process that we do to monitor our grants so that we can see how everybody is performing. What you're gonna see come out in the next couple of months is a website from the Office of Homeless Services. On that website, it's gonna show what's going on with HAP funding, where we stand with the expenditures, how much money is being spent. It also is gonna have dashboards that show what's the performance measures in HMIS. I noticed when I came here, there wasn't an OHS website. There was just a San Bernardino County Partnership website. And when we started to call that our website, the community said, no, it's ours. So we had to make a separate website to get our information on it. We literally have just a few more steps to go. We've been working internally with IT to get this done. So once that's done, we want to make sure we're being transparent in how we do services. I don't like keeping a veil behind what's going on. It's public knowledge, public information, and it's public funds. So we should be able to tell you guys what's going on. So as a county, we're just trying to do a better job with the transparency of those things. I cannot make up for what might have been done before I got here, because I hear that a lot. All I can do is forge forward and get something moving in the way that we're trying to move right now. And that's a way to be a little bit more collaborative and a better partner with the community. Last thing is, in addition to those items that we're talking about, we have a transitional rents. We're working with IHP because I know a lot of you that are community supports know that that's coming about in January 1. They're looking at the county to administer those funds, so we're working on our process internally to figure out how we can administer those funds. And then Janet's came up and told me many times about the need in the area for funding. I can't just arbitrarily say, this is what we're gonna do, but I can tell you that as a county, we are looking at the area and the needs to see how do we resource better in this area to support what you guys are doing. I do have a ton of outreach supplies in my warehouse. We just brought some to Janet. It's open to any of you guys that are there. One of the things I did when I got here, because I used to see a lot of women in the river bottom and they needed specific items, is we have items that are specific for females to help them with sanitary needs. And then we have the chargers that everybody loves to charge their phones. So we have a lot of that stuff. So if you need them, just email us. We have warehouses of it that I need to get rid of. Yeah, so we need to get that stuff out as soon as possible as well. I'm open for, if it's opportunity, I'm open for questions if they have. Oh, and the point in time count is coming up, sorry. And so we're gonna start having our meetings on the point in time count.
For 2026?
Yes, sir. Yeah, okay. We have to start a little early just to make sure.
Very good.
Yes, sir.
Great overview. Mrs. Skeeter.
I have a question. For individuals that have contracts with the Department of Behavioral Health,
Yeah.
are not required to input HMIS.
Yep.
Is there a different system that you guys are using for that? Because we always said we can't input because they don't allow us to for our contract.
Yeah.
Is there a different?
So we've already been meeting with, so part of the transition is in reaching as well. So that's working with the internal county departments so that they're all communicating with us, which is the reason why we're kind of getting the CFS funding and some of the DBH funding as well. They will be meeting with the providers to get them entering in HMIS. We're just trying to get the licenses and everything ready and then do the training for it.
Thank you.
Yes, ma'am. Yes, yes, ma'am.
Hi, you mentioned the point in time count
Yeah.
is coming up.
Yeah.
I'm a little bit new this year. I haven't been here a full year.
Yes, ma'am.
Is there a way that we can get trained so that we have a clear understanding on who?
Yeah.
How do I go about doing that?
Yeah, so part of the point in time count structure is to have trainings. There's some in person, there's some virtual. So we'll make sure that those are done. One of the things, I met with Dr. James, and we try to make sure we're doing things, you know, the right way in what we're doing. So we're gonna ensure that we have adequate time prepared for individuals to get trained. But another thing that we're doing is we're hitting some of the hot spots now, so that when we put maps out, we would have gone out and verified that there's people there. So that's why my teams are going out in the field now, because I'm just in full transparency, I wanna make sure that we're covering the areas where the homeless really are, because I think sometimes some of those areas might get missed, and I just need to feel better about the coverage area of the points I got.
I passed out my card. If you feel comfortable, would you mind emailing me?
Yeah, no, I got you right here.
I went out with Leah in the back there, just to look at some about potential partnering with, they have mat services, we have mat and stuff like that.
Yes, ma'am.
And I might have some ideas that might be able to help.
Yeah,
But I would
good.
like to contact just so I understand, so I can get some trainings and stuff.
Yeah, no, I'm good. I'm always, I'm gonna say always open, because I say that and then she'll get mad at me, because she'll be trying to figure out how to pencil people in.
Sure,
But-
sure.
But, I am open to see what we can do to improve it, for sure.
Yeah, I just wanted some training.
Yes, ma'am. Yes, sir.
Yeah, I'm glad you guys are starting the point in time count earlier. I was gonna participate last January, and I remember going to Claudia's training, but at that time I had the flu really bad, I got sick, and it progressed. I was off work for 3 months due to a neurologic impairment, and I ended up kind of falling through the cracks in our healthcare system and kind of got a taste of what it's like to be discharged from the hospital with no phone, no glasses, not being able to see. I know these are people that are overlooked. They might not be classified as homeless because they're living out of a hotel or whatever. Is there anything we're doing? And the thing with pets too, because I had my dogs, I worked down in Desert Hot Springs and Palm Springs along a lot of these issues, because they're across, like Desert Care Network, for instance, that is our healthcare system, and it crosses county lines. And there's a lot of different agencies like Reach Out, a few others that have programs in other counties that I think that's kind of what I've been working on. So my question is, what is the county doing to like work on like collaborations like beyond just your typical programs? Because when what's her name, Maricela Hernandez from Inland Housing Solutions came, she said, well, you actually qualify for, because I'm being evicted from my personal house because I've been off work for quite some time, but yet that's all frozen. So people think there's all these programs out there, but really they don't have funding. So what are we doing to like, collaborate more? I mean, I appreciate everything you're doing. It sounds like you're kind of making up for a lot of the inadequacy you've had in the past. You've got a big job, I get it. So I'm just kind of curious.
So I can tell you, we have like we're actually bringing someone for community engagement specifically, because not just for that part of it. I like to be connected to the people with the lived experience. So there's a segment of what we do to remain connected to those with lived experience, and then the providers as well, because they help us understand our system. And I never want to get so detached from what their needs are that we're just putting things in place that we think is valuable, and then the individuals who are on the other end are not able to use it. So there's meetings that we're starting to put in place for that. In fact, one of the things that I did recently was met with the regional, that's how I met Robin, like face to face, was we met with the regional steering committees, because what I'm trying to do is get a think tank together of people that I can talk to as I'm thinking through strategy and things of that nature. I just need some people who are gonna think about strategy and not just complain to me about what's wrong, but who can come to the table and let's process, like, how do we come up with solutions? So we're trying to put those things in place now to be a better, like, all around, and not just on specific initiatives. I think I saw it. Yes, ma'am.
So, first and foremost, thank you for being here.
Yes, ma'am.
I really appreciate that. I appreciate the vulnerability.
Yes, ma'am.
I always tell people, sometimes like, oh, she's a little rough around the edges. I'm like, no, I can clean it up. I want to blaze you guys. But I'm a poor kid from the ghetto.
Yep.
My parents grew up with substance abuse, in and out of prisons. I've been homeless. I get it.
Yes, ma'am.
So that's why sometimes I'm very passionate about these things. You brought up scanners, and I still have the nurse brain.
Yep.
In the hospitals, even when you're in charge of box of tissues, you scan the patient.
Exactly.
Is that the same thought process?
That is the same concept.
Perfect.
And so what happens is, basically, the card that it prints is like an ID card, but it has a barcode on it. So instead of you having to log in and pull up that individual's information, you scan that barcode and it gives that credit for that service that you're trying to get at that time. So that way we can speed up the use of HMIS, because a lot of times it's tedious to say, what's your name? Or and you're looking it up, and it hurts the workers in time. So then they don't want to do it. So for us, we're just trying to find ways to improve that.
Good idea.
And then my second question to you is, you said you're looking for a hotel or
Yes,
a,
yes.
a business, you know, a facility to house individuals for congregate housing. Does it have to be a hotel, or would you be open to working with a nonprofit, or maybe a potentially, like if I had 10 Airbnb owners that are interested?
Let me just make sure with the funding. I don't want to say yes without making sure what the funding allows. But we wrote in there, the non-congregation. I just need to look. Let me just make sure.
Okay, sounds good. Let me know. Thank you.
Yes, ma'am. Thank you. Yes, ma'am.
Hi, I'm still active in HMIS, so I'm trying to process what you said with this card.
Yeah.
Okay, so the card would go to maybe the people that are doing street outreach, right?
No. So
who's gonna get the card first?
Yeah, I got you. So there's a client portal that we opened up in HMIS. So HMIS has always historically been for the providers. So when I got here, we started working with BidFocus, and now we've opened up the client portal. So what the client portal allows is for the clients to actually engage with their case managers, make appointments, do all those various things. So part of that is they can actually have an ID card through HMIS. And that goes to the client, so everywhere they go, if you have that scanner system, they just pop that card out and you're able to scan them into the system. That's a demonstration we'll bring up here, because that's what we just did. And I apologize, we'll bring it up here for everybody.
It would be good to understand, like the process, because still, to actually hand the card to that client, it's going to be, like with Sparks, for example, or maybe with Kita, somebody is going to have to hand them that card,
Absolutely,
right? So that's what I'm trying to say. And they would already know that they were in the system as a client versus the provider trying, having entered them in already. Okay.
So basically, what it is you guys that are doing outreach or doing shelter services have clients coming through your doors anyway.
Right.
All you're doing is you're adding this card element to it to be able to key in the services that you're providing in the HMIS without having to go in and manually do it.
But we would also have to make sure they understood how they can access the portal.
That'll be through our kiosk. So all that you're talking about, we just did an open house on, and that's why I said I need to have my team come up here and do it for the individual.
Orientation.
It's an open house. It just, because we have a bedding unit inventory module that we just put up where we're able to see the shelter beds that are open. We have an outreach module where now we're tracking where all the encampments are. So as my team goes out, they'll be tracking all the encampment locations in HMIS so that people who have access to it can see where the encampment locations are. We have the client portal and then the scanner method as well.
But it'd be like a field trip to travel to you for that?
No.
Okay.
Like let's say Lakita, for an example. She has housing in the shelter she is. I would just get with Lakita and say, all right, Lakita, I'm gonna get you a scanner, get you a printer, everything, set it up in your site. Her staff will be able, as they're working with these individuals, print those same ID cards and everything and scan them. Yes, sir.
Thank you for driving out here. It's a long drive, and I hope you enjoy this cool summer day.
I don't know, because as I got closer, I started sweating.
And that being said, please drink way more water than you think you need to in the desert, because it sucks the moisture right out of you. Anyway, thank you so much. We really appreciate all you're doing. And you're obviously doing tremendous work. And I can speak on behalf of all of us. We are so grateful for all of your help and support.
Yes, sir.
So thank you for that. Is there a date scheduled yet for PATC?
January. Oh, okay. I just got my coat pulled. We'll get the date out.
Okay.
We have to do the point in time count according to HUD regulations the last 10 days of January.
Right.
So that is a discussion that we're gonna have with our consultant, And, we're gonna look at the dates and see, usually it is the fourth Thursday of January, but because that is so early in the year, we're gonna be discussing those dates. So it'll be within the last 10 days of January.
Thank you. And just with the funding, because I heard Janet bring this up, as HAP funding comes out, I'm hoping that regions work together to put projects together, and I'm gonna explain why. If you do that, then we can write an RFP specific to what your region is looking for, so that you're not just getting proposals for random activities. And I think that's important, because what Janet brought up, and I think it's just maybe a blend of understanding of a couple of things, but when submitting for HAP, the county says, we're gonna decrease homelessness by 10%. And then if you're putting out the same standard, programs, and you're not seeing the number of people come off the streets, even though you're doing the work, if HAP doesn't generate it through HMIS, then the state's gonna start questioning and saying, what's going on with your programs? But if you come up with a program for something, and if it's whatever that program is, I don't wanna make a recommendation, but if you come up with a program that you know in your region, if your homeless count is whatever the number is, and you're saying, we're gonna target 10% of these individuals by doing this particular program or project, then you can put all the funding in there. You could sub it out to whatever provider it is, but you're working collectively and a little bit more strategically towards a goal. And I'm saying this to all the regions now, not just you guys. Because I think what's happened historically in this county is, it looks like a money grab. And so people looking from the outside think they're just giving money to people who aren't really doing much with it. And so, but if you come with strategy and you start speaking to the need of your region, and you speak to how you're gonna reduce the homelessness, then those things are more effective. Those are easier conversations for me to have. It's hard when I'm just doing rental assistance. Everybody's doing rental assistance, right? So what are we doing a little bit different? What are we doing that's sustaining them and making sure that they stay out of homelessness? So I just wanted to put that out there, because when you talk about funding, you just gotta make sure you're speaking about all of the factors that go into it. Sorry.
I think that I said this the last meeting. We need to realize there's more funding besides the HAP.
Correct.
Everybody wants to jump on $30,000, but for my organization, that is no money. For the amount of people that I have to service, you guys need to look on ePro. If you get some of those bigger contracts, they're 5 years, and you're gonna be able to invoice for $30,000 a month. You guys need to make sure that our organizations are growing out here, because our populations are growing. So a lot of times when I hear you guys talk about the HAP funds, I'm like, 12, no disrespect, Mr.
Yeah, no, I know.
You gave I think it was like $70,000 that needed to be divided in 5 categories. I was offended to apply for $15,000 to service how many people call our phones. So we need to go after other funding besides HAP, guys.
But what I'm talking about, and when you talk about strategy, let me just break it down a little bit. So community supports has the housing trio. It's deposits, it's rental assistance, and it's aftercare, right? So let's say you have 2 agencies that are doing that. You don't have to go for that, because you know you can refer to those 2 agencies for deposits, rental assistance, aftercare, or 3, whatever your number is. So then what can you do in addition to that with the HAP dollars? Because you have this secured to actually build out what you're doing and move individuals back and forth. It's understanding and leveraging the funding. I have to do it. Like I still have to do it, even working with the county. I have to leverage funding and make sure I can serve more people. And that's something that you have to think about when you're having these sessions, because I think it's critical to be successful that way. Yes, sir.
Still expectation for this round of HAP, the same way we did last time for this body to do the review and do the
yes, sir.
up.
It will. I'm trying to keep it that way for a little while, but I'm gonna tell you there is gonna be a change, because in the new charter, they didn't write in the regional steering committees doing that. It's gonna go through the COC membership. But that is still your place to have your voice, right? But there is gonna be a change to it. But this round, it should be the same. And what Janet mentioned earlier about the 2023 numbers being used, that will be corrected.
It will be.
It'll be corrected. All right.
I just had a question about the cards for HMIS.
Yes,
Will
ma'am.
there be a limitation on how many cards they can get? Cause
no.
I have a lady right now I guess Social Security, you can only have 17 cards if you lost it, and she's well over that.
That's
So they
up to
won't
you.
even give her another Social Security card.
It's up to you, your agency and your site, like I won't control that. Once I give you the scanner and the printer, it's yours.
Okay.
Like I'm not gonna come back and reclaim it.
So,
It's yours.
so each agency will have their own like card or brand, and
So-
then it will tie into their
It will,
universal.
but
kind of-
we're not gonna buy for every agency.
Okay.
It's the ones that are serving like the shelters, the food pantries and things like that, because those are the supportive service elements that require a lot more activity. So we just wanna make sure that that activity is being captured in.
Would there be a way, like, say you have an agency that has like IT capabilities, like say for instance, the hotel I'm working with, you know, he does about 10 rooms out for people regularly. So like if we have capabilities like the hardware to do it, like and we just need like the access to the portal, or is that something that you can work with? Or even if you just like have a login, you know their barcode, we don't necessarily need to issue them an ID card, right? But like if they have a barcode with someone else, we would just look at that and say this is the person we're helping.
Let me check, make sure I'm not.
'Cause IT was my background back in my 20s, so I kind of see the analytical side of this. So that's a good concept, because a lot of these providers up here are duplicating their work and they're not getting credit for it. I think this is a good start.
Yes, sir.
Quick question, the kiosks, is one gonna come up here or two possibly for Yucca and or 29?
We just need to figure out where it's gotta be, so we need someone to agree to host the location of it.
We have the Pacific Clubhouse in Yucca, and they also have a location in 29. That
Yeah, as long as
And then-
whoever agrees to host it, just let us know. Yes, sir.
Mark, as we finish up, thank you for coming out today.
Yes, sir.
And for those of us that have been around for a little while, the momentum and the change in direction that we're seeing from OHS specifically, and your team has been amazing.
Yes, sir.
So, wheels of government move slow, we
Yes, sir.
understand that, but we're moving and we're trending in the right direction.
Yes,
Thank you
sir.
for your entire team for that, particularly, in looking at a potential shelter, as you're talking about up here, that's something that the Morongo Basin has been in need of for a very long time.
Yes, sir.
So anything that we can do specifically for